So my name is Stéphanie Debette. I'm a neurologist and epidemiologist, and I currently work in Paris at the Paris Brain Institute and also have an affiliation with the Bordeaux University and University Hospital. So cerebral small vessel disease in young individuals can be due to monogenic familial etiologies and also to complex multifactorial causes. The vast majority of cases, even in young individuals, are multifactorial. So they are due to the combination of multiple genetic and environmental risk factors. So it's very difficult to list individual genes for these multifactorial contributions. There are over 70 genetic regions in the genome that have been identified to increase the risk of small vessel disease. The most prominent one is probably on chromosome 17, harboring the gene called TRIM47, of which the loss of function is shown to be associated with enhanced small vessel disease features. On the monogenic familial side, there have been about 10 genes identified to harbor rare mutations that are sufficient and necessary to cause a familial small vessel disease feature or form. And so these comprise genes, for instance, such as Notch3, the most commonly affected gene causing CADASIL, but also HTRA1, which can be causing recessive and dominant forms of the disease, as well as collagen 4A1, 4A2 mutations, for instance. And obviously there are a few more, as I mentioned. So currently, it is recommended to conduct genetic testing if a certain number of conditions are fulfilled in young patients with cerebral small vessel disease. So first of all, young age, the younger, let's say, the highest the risk. Second, if there is a familial history of small vessel disease, so stroke, dementia, or even specific features on brain imaging. A third element is if there is evidence of consanguinity in the family, which increases the risk of recessive conditions. And then you can be guided also by the clinic and by the imaging features. So there are a number of clinical presentations that are suggestive of familial monogenic disease, such as, for instance, the combination of migraine, depression, and small vessel stroke that may suggest, for instance, the CADASIL condition, or certain specific imaging features on the brain MRI that may indicate a specific other subtype of small vessel disease. So for instance, hyperintensities in the anterior temporal lobe, which may be suggestive of a number of monogenic conditions. Or sometimes you can have extra neurological, so non-neurological systemic features of the disease that also raise a red flag. So the question of preventing stroke and also, I should say, dementia, cognitive decline and dementia in young patients with small vessel disease is a very important one. And maybe as an introduction, I would like to highlight that small vessel disease has the specific feature of being often diagnosed at a covert stage, so before a stroke occurs. So this really gives a possibility of, I should say, almost primary prevention in people in whom small vessel disease has been detected on brain imaging. And so currently there are actually few guidelines, and they are based on relatively weak evidence on how to manage these patients with covert small vessel disease for the prevention of stroke and cognitive decline and dementia. So these were guidelines produced by the European Stroke Organization, and they recommend first thing to really control blood pressure according to current blood pressure management guidelines in primary prevention, with blood pressure thresholds of or targets of 140/90. There is some evidence that more intensive blood pressure lowering may slow down the progression of the imaging features of small vessel disease, but not enough evidence that it is clinically useful. So currently it's sort of a conservative recommendation, but with a very strong indication of monitoring the efficiency of the treatment of blood pressure, because often blood pressure is not well controlled. And then a second aspect is that Antiplatelet drugs should be withheld, should not be prescribed as a preventive treatment currently overall in persons with small vessel disease lesions if they have not had a stroke yet. Obviously, if it's secondary prevention, that's another question. But in the primary prevention setting in persons with silent covert small vessel disease, it is recommended not to prescribe antiplatelet drugs. And then I suppose lifestyle management, optimizing lifestyle and regular management of other vascular risk factors is recommended as well.